Hello, this is Dana Arcuri from danaarcuri.com. I am an author, speaker, and wellness advocate, and today's topic is when medical treatment becomes trauma. And so this may be something new for you. This may be something you've never even heard of, but it is an epidemic that's happening today within our world in which patients are having serious trauma to their central nervous system when drugs are either A, abruptly stopped, B, their doctors force them to go cold turkey, or their doctors decide to not taper them in a more slow, gradual method. It may become a lot more faster, which then increases the negative symptoms and the potential loss of life and possible damage to the body and central nervous system. So it's really interesting that there's this phenomena going on today, and most people aren't even aware of it or talking about it. But as a patient who has endured some serious trauma, and it's medically induced trauma, I believe it's something we need to start discussing. We need to come up with some solutions, and we need to build awareness. So I was really excited to see that someone is speaking about medically induced trauma. And I was watching a TED Talks video with a gentleman who was in an accident, who endured some very serious injuries to his body. He was in excruciating pain. At one point, his physician decided to prescribe opioids for the pain, and the patient really wasn't given information about the medication. He wasn't educated. His doctor really didn't provide him a lot of help as far as understanding the pros and cons of this prescription. But then out of the blue, without warning, the doctor decided to just abruptly stop the opioids, to kind of like pull the plug on the patient. And this is something that, while it is happening today in the opioid epidemic, you know, there is this crisis going on. Most of us know about that. But it's happening also with other medications, especially benzodiazepines, Cymbalta, various tranquilizers and antidepressants, as well as painkillers. So we have to understand that patients who have pain, and then they're either A, cold turkeyed, B, there's a fast and furious taper, whatever manner it may happen, whether it's fast or whether it's slow, what could happen is the patient's pain levels increase, and then the patient may have actual trauma occurring to the central nervous system, which is the brain. So the brain is directly impacted, and there is serious damage done. And it's something that most people are not even aware of when it's happening to themselves, that this is trauma. You know, we can understand that it's excruciating, that we're going through wicked withdrawals, that we have adverse effects when these medications are either A, being tapered, or B, we might actually still be on them, but we're experiencing some very weird situations where we're not having the outcome that we had planned or hoped for. There may be a lot of interactions. There may be some strange happenings with medications. For example, you might be prescribed a medication for pain, but instead of helping you with pain, it might actually cause you more pain. Maybe you're taking it for sleep, so instead of helping you sleep, it's causing you insomnia. But when a physician decides to abruptly stop the medication or to just pull the plug, maybe it's without warning, maybe you are not told, okay, we're going to taper. Maybe you were not given that opportunity to wean gradually. And so what can happen is your body is really experiencing a lot going on within it. So with your neurotransmitters, with your brain and so forth, there's a lot happening. It's a very painful experience because it puts a patient in a vulnerable situation where they don't have control. So they might have behaviors and moods and irritability. They might become totally different. They might become a very aggressive person, a hostile person. They may do things they never would have dreamed or fathomed that they would do. People, when they're going through some wicked withdrawals or this abrupt stop of prescriptions, they may become homicidal or suicidal or both. So it's extremely dire. The whole circumstance around it is the most frightening experience a patient can go through. And many people who have never personally gone through this, who have never dealt with either a negative side effect from medicine, or B, cold turkeying, or C, a doctor doing a fast and furious taper, or maybe even it's not fast, but maybe it's just not gentle enough and it happens too quickly, this whole cessation of medicine. So if you haven't experienced it, or you've never even been around someone who's experienced it, it might be hard for you to wrap around your brain that this is happening, that this is an epidemic, that our world is being medically traumatized by these types of things happening, and most is with pharmaceutical drugs. Now, I'm sure that there could be surgeries that also could produce trauma in one form or another, especially when someone is having, say, a leg amputated and there was an accident and they amputated the wrong body part. I mean, these things happen, and being that I have a background in the medical industry, I have seen with my own eyes, I've experienced professionally that there are things happening within hospitals and the medical community. And that's why they have malpractice insurance. I mean, that's the beauty of malpractice insurance. They need it to protect them. But we have to also understand that doctors right now today, they want to wash their hands of the responsibility with patients. Right now, it appears that most doctors, they don't care. They don't care about the patients, especially in the opioids, this crisis happening. They're pulling the plug. The patients are left to wing it on their own. There's a lot of suicide happening. If you're on Twitter is one place I could say I'm seeing a lot of stories, heartbreaking, disturbing stories of real people with real problems, not just opioids, but that happens to be a popular drug right now where there is a lot going on, a lot of negativity, a lot of suicides, a lot of pain, a lot of doctors who just, they don't want to continue prescribing it for whatever reason. Maybe they fear losing their license, and so they just, without warning, stop the medication, and then the patient's in a very, very bad position because they're sick, their pain level is increased, their anxiety is increased, their mental health is directly impacted, their central nervous system is going absolute haywire, just haywire. Their life is falling apart right before their eyes, and most of their family members do not know what to do. They don't know how to help them. They don't know how to advocate for them. I mean, people are literally just screaming and crying for help, and yet it seems like they're just being ignored. It really honestly seems like much of the medical community is ignoring this cry and this plea for help. And so today, I personally think it is heartbreaking. I think it's something that is an epidemic. Medical-induced trauma is happening. I've experienced it. I am a survivor of it. Next week will be my 8-year anniversary of being free from Cymbalta, also known as duloxetine. That was a really horrific experience, and I wanted to get healthy. I wanted to get well, and instead I became even more sick, because what happened was I found out there was another medication that was also severely interacting, which was the Ativan, benzodiazepine, and it was severely interacting, and just benzos in their own, independently from any other drug. Just if someone's even just taking, say, one drug and it's a benzo, I mean, that drug in itself is a very potent drug. There are a lot of long-term consequences with that medication. You could do your own research. Please build awareness, because it's extremely important, if you are prescribed that drug, that you understand that many patients are now discovering that benzodiazepines can cause brain damage, it could cause Alzheimer's, it could cause suicidal ideation, homicidal possibilities, where people are really becoming dangerous and violent. I am thankful that that's behind me. I'm thankful especially that I survived the Cymbalta nightmare. I'm thankful that I'm reaching my 8-year anniversary. It is a hallmark moment of seeing how far I've come, of seeing that, when we give our bodies the ability to heal naturally, without medication, without any synthetics, so we're focusing more on plant-based. And of course, I understand that there are pharmaceutical medications that may contain some plant-based ingredients. You have to understand that when you take a prescription and it might have 1 or 2 plant-based ingredients, but then you mix it with synthetics, it's no longer pure. So people have to understand that just because a drug claims to have a plant base to it, that when it is changed and it's altered because synthetics are mixed in with it, there's a combination of ingredients. These synthetics basically diminish all good from this drug. And so you could agree or disagree, but I personally believe that it's those natural ingredients, the non-GMO, the non-synthetic, the drugs that are very much from the earth. They are plant-based. They are free from all the preservatives and the garbage ingredients that most of our grocery stores and pharmacies are just filled with. There's so many toxic ingredients combined. I mean, even if we look at the flu shot, it has mercury, it has formaldehyde, it has a lot of toxic ingredients. And not to mention you're putting the flu into your body, which then would give you a higher potential to end up with the flu. So many people are experiencing this. Many people are experiencing the trauma that is induced from various medications or various vaccinations and flu shots and what have you. It is an epidemic. And just because you didn't experience it doesn't diminish that it's happening, doesn't diminish that it's real, doesn't diminish that this is something of a concern. This is something that's changing and altering people's central nervous system. It is harming people. It is endangering people. And we have to understand that you do not need to be a licensed physician or a pharmacist or a nurse in order to understand medicine, in order to understand the pros and the cons, in order to educate yourself and build awareness about it. So while I do have a medical background, I used to work in the operating room and assist with surgery. So I used to be, the person right next to the physician, the surgeon, and I was right smack center in the operating room doing some amazing things. And it was, a wonderful opportunity. I'm thankful for it. But that's not how I gained insight about a lot of the medical mishaps and the medically induced trauma happening today. It was really as a patient that I've gained so much more knowledge, and because I do have a medical background, I'm super into the whole terminology and the learning and the just soaking up all this information. I'm just really into resourcefulness. That is what I'm all about. And I have a passion for helping people, to give them hope, to empower them, to be that voice for people who may feel like they lost their voice because right now they're suffering. And maybe right now they are going through withdrawals with drugs. And I'm thankful that now I'm hitting my 8-year anniversary with the Cymbalta free. And then next year will be 8 years free of Ativan and every single drug, and really taking a good look at health and a good look at how can we increase our quality of life without synthetics, without harsh ingredients. How can we do this just ourselves? When we put ourselves in the driver's seat and we become the CEO of our body, it really does blossom into something beautiful, because then we have a better appreciation for our health. We have a better appreciation that, we might not be doctors, we might not be nurses, and someone might not even have any experience whatsoever in the medical industry. But when we start really doing our credible research, we understand that then we're in the driver's seat, that nobody knows our body like we know our body. Nobody knows us. And so many times patients, they place their physicians on a high pedestal and they don't realize that they're giving the power away. So today, take back that power, start doing some research, and feel free to check out my websites. Bye-bye.